Hello and welcome to Talk to Your Health. I'm your host, Dr. Derek Da Silva. An estimated 50,000 people are diagnosed with kidney cancer each year. Many of those patients will have to have all or part of the diseased organ removed. Our first guest was one of the first surgeons in New Jersey to perform a new, less invasive surgery for kidney removal. Dr. Gregg Zimmerman is a urologist with Morris Urology and medical director of the robotic surgery program at St. Clair's University Hospital in Denville. Also with us is Christopher Walthour of HepatCon, who underwent this unique surgery. Gentlemen, welcome to both of you.
Thank you.
Dr. Zimmerman, let's start with you and ask about kidney cancer. How common is it? I mean, I said 50,000 people a year, and compared to other forms of cancer.
Well, kidney cancer is not uncommon, but it's not the most common cancer either. It can be very dangerous, and it's important that you find it at early stages.
And Christopher, what happened? How did we find this out with you?
Well, in my case, I went to the emergency room with pains on my left side, and they did a CAT scan to determine what issues I was having, and it turned out that the pains that I was having was colitis, which was an intestinal infection. But at the same time, they found a mass on my right kidney.
Mm-hmm. So God was really looking out for you to do that. And you know, it's interesting, it's ironic that you just said that, because I had a patient who presented the same way. You know, it was just found out accidentally. So what are some of the symptoms that we need to look for here, Dr. Zimmerman?
Well, what we call an incidental finding is the most common presentation today. Basically, patients are getting CAT scans or MRIs for other disease processes which may not be serious, and we're picking up these masses. In years past, when we didn't have modalities like CAT scans and MRIs, these were found because of symptoms such as blood in the urine, pain, or even a mass.
Mm-hmm. And what are some of the risk factors? Who typically gets kidney cancer?
Kidney cancer is not one of those cancers that have a clear cause. Smoking has been linked, as has obesity. It also can be present in families, so there is a genetic component, but there is not a clear cause for kidney cancer.
Now, Christopher, do you have a genetic history? Did you smoke? You don't look like you're overweight. I mean, do we know what happened with you?
Not really. I did smoke in the past. I haven't smoked in the last 7 or 8 years, and I really just don't have an answer for why it happened.
And what about this procedure? Tell us a little bit about this.
Well, the way surgery has been going...
Now, by the way, this is not a robotic procedure, is it?
No, this is a minimally invasive procedure, as robotics are as well. But this is called laparoscopic surgery. And it used to be that we took out organs by making big incisions, and we were very successful in getting cancers out. However, patients had long recovery periods. So then laparoscopic surgery was born, and we were able to take organs out through smaller incisions, but they were multiple. This procedure is called LESS, Laparoendoscopic Single Site Radical Nephrectomy in this case. And what that means is
say that 20 times.
Right. and basically what you're able to do is remove the kidney through only one tiny incision, and that has implications on your recovery and getting back to your normal lifestyle.
And we have this. Can you just tell us what this is right now that we're looking at on the screen?
This is actually the device. The bottom part of the device goes into the abdomen after you make an incision, and then the top part connects to it. The device is actually much bigger than the incision. You see on this demonstration there are 3 what they call trocars, which are the working elements, and that's what you're working through with your hands very close together to get the kidney out. It's very, very technically challenging type of procedure, but very successful.
Wow, that's pretty interesting. Now, I guess recovery times, Christopher, as far as your recovery time, you went in when, came out when, did you go back to work, what happened?
Went in on a Monday afternoon and had the surgery, and I was home on Wednesday afternoon. So it was only spent 2 nights in the hospital, and I was back to work within 2 weeks.
Wow, versus opening up the belly to take out the whole kidney, right?
Where you might be in the hospital for up to a week.
And then what about infection rates and things like that? I'm sure it's much less than the other procedures.
Much less. Patients typically get an antibiotic during surgery and a couple of antibiotics afterwards. They go home without antibiotics. And the infection rate is very, very low in these procedures.
And post-procedure, when you got home, did you have any restrictions that Dr. Zimmerman told you about? Don't do this, don't do that, or what happened with you?
Basically, you know, just be careful for the first week, and, you know, do what your body basically tells you to do, and don't overdo anything.
As far as follow-up for him, does he need staging? Does he need, what did you do prior to the surgery to stage the cancer, meaning did it spread, et cetera?
Well, typically, depending on what the tumor presents like where it is, size, it will dictate what you do. You typically always get blood work. You get a chest x-ray because the lungs is an area of the body where kidney cancer can spread. So in follow-up, you continue on with the same modalities. We will get a CAT scan to look at his abdomen and pelvis, a chest x-ray to look at his chest, and follow his blood work.
Who cannot have this procedure?
People that have had multiple surgeries it may be difficult to do this procedure. However, there are no absolute contraindications to this procedure. If someone's not healthy enough for surgery, then clearly they can't. But what it involves is insufflating the abdomen, meaning filling the abdomen with carbon dioxide gas, and that's how you get your working space. So you have to be able to tolerate that as well. As you gain more experience, you can offer this to more and more people.
So this is something that could probably has applications in other procedures also, gallbladder, et cetera?
And it has been done for gallbladders, for colon, and things of that nature.
Very good. Gentlemen, thank you very much for joining me, and good luck to you.
Thank you.
As the process continues. I appreciate the time here today. Folks, keep it right here, because coming up in just a little bit